Okay, so now that we've talked about that, let me check the. Actually, before I put on the left ventricle, what I'm going to do is I'm going to discuss exactly where blood goes then. So we've entered the left ventricle, okay, and then blood goes takes the oxygenated blood, remember, from the pulmonary vessels, and then takes them, then this enters this valve. Do you know what valve that's called? Okay, so that valve is your aortic valve. So as you go up into your aortic valve, okay, you're going to enter your aorta. Now, what is the very first bit of your aorta called? Okay, so that's going to be your ascending aorta. Okay, so as you enter your ascending aorta, it's at that point then where you're going to form this arch of your aorta. Now, the arch of the aorta is, again, important because it has these 3 branches coming off. Now, one of the easiest ways to remember this is the mnemonic A, B, C's. Okay, so A is for arch of aorta, B is for brachiocephalic, C is for left common carotid, and S is for left subclavian. Okay, so you've got those 3 branches coming off your aortic arch. Now, as you can see, the arch of the aorta is then, just before it's about to go down, it has this structure attaching it to the pulmonary trunk, which we're going to talk about in a minute. But this structure, does anyone know the name of that? Okay, so that's going to be your ligamentum arteriosus. Okay, so ligamentum arteriosum. This ligamentum arteriosum is what is used in intrauterine life to allow the connection between your pulmonary trunk here and your arch of aorta. It's supposed to close during birth, however, in some people it doesn't, and that is what results in patent ductus arteriosum. Basically, a connection between your trunk and between your pulmonary trunk and between your arch of aorta. So that's not ideal. Okay, so then after that bit is where we enter this bit of your aorta. Okay, so this is the descending aorta. Now, the difference between the descending aorta and the thoracic aorta, well, there is none. The descending aorta is the whole way going down. So as the descending aorta goes down, it's going to pierce a structure here. Where is the structure here that lies underneath the heart? So again, we're looking anteriorly now at the heart. Okay, perfect. Yeah, that's your diaphragm. So the descending aorta, otherwise known as your thoracic aorta at this region, is going to pierce your diaphragm at what level? Okay, perfect, at T12. And then as it goes through that diaphragm, that's where it's going to become your abdominal aorta. You can also still call it descending aorta. So descending aorta is all the way down, whereas thoracic aorta is just up here, and abdominal aorta is just down here. Okay, so I think we're relatively happy with that. So what I'm going to do is I'm going to pop your left ventricle back on.